Awesome. Well, it's an absolute honor to have the opportunity today to speak with Dr. Samuel Young. For those who I have not had the chance to meet, my name is Dan Hammer. I'm an oral maxillofacial surgeon here at Navy Medical Center, San Diego. I've been here for 5 years and been active duty for starting my 14th year. And it's an absolute honor as we look forward to celebrating Veterans Day and our military to have the honor to speak with Dr. Young. So before we get going into a lot of great questions and conversation, I'm going to turn it over to Dr. Young to introduce himself and tell us, really how he's gotten to the places he's gone to. Go ahead, sir.
Thank you so much, Dan. What an honor to be asked to participate in this forum. Just a little bit about myself. I came into the military way back in 1980, okay, via the Health Profession Scholarship Program, which was a wonderful program for me because I had the need for financial assistance. The Health Profession Scholarship Program is just really awesome. I highly endorse it. And so after completing my training, I completed my training at Harvard, graduated in 1980, and then immediately came into the military to pay back my 3-year obligation. Circumstances had it that I needed to stay in the military because coming from Massachusetts to California, it was a real transition. And way back in the day, they were quite biased against non-California dental students. So it was really difficult to get through the California boards. I'll just say that. But anyway, I stayed in the military. That was a good thing because it allowed me to stay in the military for an additional 3 years, and which time I was able to do the mandatory 6 years before you can apply for residency. And so after doing an overseas tour and a shipboard tour, I applied for the residency and was accepted into the program at the Naval Hospital, Oakland, which was a joint program with Travis and Highland Hospital. What a great program that was. Great experience working with those residents and the Air Force leadership and the Navy leadership and civilian leadership all together. Wonderful program. But anyway, I finished that, and I'll speed it up. Finished the residency in '89, and then went aboard my first duty station post oral surgery, which was the USS Carl Vinson area, and did amazing deployment on the Carl Vinson. 2 months workup followed by 6-month deployment. That was quite exciting. And another time I'll get to talk about that. But anyway, I ended up staying in the military at various duty stations for a total of 33 years. Wow. I did 30 years, and then there was a shortage of oral surgeons, and so they offered me a retired retained position, which I accepted for the first 3 years. And so that's where I got the additional 3 years, 33 years. I decided not to do a second tour and got out of the military in June 2013. So that is 11 years ago. It's amazing that the time has gone by so quickly. And in the interim, I worked in private practice as a traveling oral surgeon. Had a great time doing that, working 1 day a week, and really enjoyed that. And I wanted to get back into teaching, and so circumstances had it that I ended up getting a position at Loma Linda. And so I've been there for the past 4.5, almost 5 years, working with the residency program there, having a great privilege of working with some outstanding, well-known surgeons like Dr. Chi Viet and Dr. Alan Herford, of course. And there are others too. I better mention their names: Dr. Tucker, Retta, Dr. Miller, and a few others. But anyway, it's been great working in the program, and that's kind of basically how I got to where I am now.
Well, I appreciate you sharing that, and I'm also going to give a plug for the HPSP program because I would be remiss if not. It's been a game; it was a game changer for my life, and kind of getting things settled, as far as affording dental education and everywhere. And
Yes.
for those who might be watching, the residents or dental students. Fortunately or unfortunately, depending on where you sit on it, you no longer have to wait 6 years to apply to be an oral maxillofacial surgeon
Yes.
in the military. So we do take people who have experience, like Dr. Young, had, and it's a great thing to have experience from the fleet, we call it, or we do take individuals right out of dental school too. So it really depends on the individual. So just want to clarify that for our future military oral maxillofacial surgeons. Um,
Yes.
so please reach out. So I'll stop my recruiting now, and
Uh,
we'll get to the question. So one of the things, Dr. Young, that I think a lot of people have a lot of questions about and don't really understand is just being an oral and maxillofacial surgeon in the military, and especially with your experience in the operational or what some might call the battlefield setting.
yes.
Um, and so there's what you learn in that amazing cross section in Oakland between military, mentors and civilian mentors. But obviously, things are going to be a little bit different in an austere setting. So, could you maybe just talk a little bit about just being an oral maxillofacial surgeon in that setting, and maybe how that setting would change how you would approach your maxillofacial reconstruction process or paradigm, especially with tissue engineering and things like that. So, just what is it like, and how did you have to adapt and overcome?
Well, in the last 10 years, there have been so many great innovations in regenerative medicine and with the things that can be done now as far as reconstruction. Back in the day when I was in the combat area, um, it is such that oral surgeons actually do not go to the actual front line where we're working immediately on the patients. They are the heroes in all of this are the independent duty corpsmen and the regular corpsmen whose job is to scoop up those casualties and bring them back to the center where the oral surgeons are in the background. We're actually in theater, but not at the forefront. So once we get those patients back there, our primary focus is number one, sustaining life, keeping them alive, limiting the amount of additional trauma, and stabilizing those patients to get them to a unit where they can get definitive care. Okay, so our front line is basically maintenance. One of the things that oral surgeons are always assigned to is that they always they have the position of being the triage officer. And so you have to evaluate all of the different casualties and prioritize them and set them aside and to get them to the immediate theater OR, to save sustain life, or just using ATLS principles to keep them alive, stabilize them, and then eventually move them along the chain of patient care. So the biggest thing is being a triage. And so you have to know general trauma and how to keep the person alive by exercising those principles. As far as the being able to use all of the additional biomedical um, upgrades to reconstruct and rehabilitate, those are all things that are done in the tertiary theater, okay, not in the front line. And that was my experience. I had the privilege of being a part of a casualty receiving treatment ship team when I was aboard the USS Saipan and going through the Gulf War. And we were in the Persian Gulf and had an opportunity to receive casualties there. Being in charge is an amazing thing because you have a team of about 80 and include the general surgeon, nurse anesthetist, anesthesiologist, etc., to conduct business and to take care of whatever casualties come on board. And you never know what's coming. So
Mhm.
you just have to be prepared
Absolutely.
and do a step-by-step assessment and treatment for each patient that comes through.
Absolutely, and I did a tour on the Abraham Lincoln aircraft carrier
Ah,
right after residency, and right now I'm on combat receiving and transport ship 2.
okay.
So I'm I'm living
Okay.
that, but definitely have to wear all the hats. And I think
Yes.
one thing about being a military oral maxillofacial surgeon is you truly have to harness the diversity of our training and backgrounds
Correct.
at all times, from anesthesia to general trauma to dental to maxillofacial surgery in general. From your experience, I think there's a lot of things we can talk about that we wish we would have in these austere settings, right? Was there any technology you're seeing today, or any technology you wish that we would develop now, that you think would have maybe helped, especially when it comes to maxillofacial, trauma and reconstruction?
Yes, and we have a lot of those things now. All the plating systems makes it really easy. Back in the day, we used wires
Hmm.
for securing fractures, and that is a great innovation in itself. Just being able to reconstruct and put all the pieces back together using all the various plating kits. However, on the front line, we don't use plating kits.
Hmm.
That's once again in the tertiary facility. Uh, and so we are just using the basics to stabilize patients. And I think in that setting, one of the neatest things is those arch bars that you just screw on. I
Hmm.
forget the name of those, but the uh,
Yeah, the
the,
hybrids.
the hybrids, yeah, the hybrid arch bars where you can just use a few screws to put them on, and then you're ready to go. That is a great thing to be used in the front line because it really cuts down on the amount of time that you have to spend preparing a patient uh, for reduction. Yes, that's a
Absolutely.
simple thing. That's a simple thing, but what a time saver it is. Yes.
Absolutely, and one of the big things, the DoD has just stood up a course. It's called CCTS, the Combat CMF Trauma Surgery course, which is now for plastics, OMFS, ENT, and etc. And not only are hybrids and arch bars part of it, but the return of the XFix
Oh,
is
okay.
in it. Because one of the big things, I learned as a resident, I was honored enough to be at Walter Reed from 2011 to 2017,
Mhm.
dealing with a lot of people you saw at the front lines. And
Yeah.
one of the big things I saw was a lot of soft tissue envelope contracture that we could never open up again,
Yes.
just from those defects. And so now, the DoD, and we're working with our NATO partners and others right now, of the importance
Mhm.
of X-Fix and getting that soft tissue envelope open,
Yes.
at that roll one, roll two, which for those listening are the very far forward centers. So then we have a place to do our bony reconstruction, wherever it might be. And we all know from our bone grafts, regardless the type, if you don't have the soft tissue,
Right.
you got an issue, right? And it's not
Right.
going to go, it's not going to
Absolutely.
go very well. So
Absolutely.
it's funny how life repeats itself, and now X-Fix is coming back in vogue, and
Yes.
um,
I remember
moving
my
forward.
I remember my very first XFix case, and it was in residency. I had a gunshot wound to the face, and it was horrendous. And
Hmm.
so being able to have that XFix was amazing because we were able to stabilize and allow things to heal so we could get in and take care of the rest. So really good. It's good technology. Still good.
Yeah, absolutely. And you bring up one point, sir, that definitely for the listeners, they might find of interest, because looking at Iraq and Afghanistan and the conflicts over the past 30 years, The big thing going on in the DoD right now is during those conflicts, we had medevacs that were very predictable, and you can
Mhm.
move patients very quickly. And the concern in the current world when it comes to maxillofacial trauma, reconstruction, and future care is, what if you can't transport
Right.
patients for extremely prolonged period of time? And so some of the innovations we're looking at right now is bone glues,
Mhm.
where it's just as durable as open reduction internal fixation, but is cure set and can be done in an austere setting with antibiotics, and how that can regenerate mandibular midface scaffolds. And so doing some pretty fun trials right now, trying to bridge the gap if you had one of those independent duty corpsmen for 4 weeks with a facial trauma.
Yeah.
So it's exciting to see how far forward some of this regeneration might go.
Yes, that is pretty incredible to have those capabilities. And I see where that would be extremely helpful in a frontline situation. Very much so. Yes.
Absolutely. So we'll see where we end up. Could you just describe, a lot of the people listening are clinicians, right? So we
Yeah.
like talking about clinical stuff.
No.
So can you describe a challenging patient or, situation on the battlefield, and how you managed it and what you thought went well, and maybe something that could do better next time? Because I don't know, I still am learning a lot every day.
Yes. Well, this is really unfortunate situation, but when I was on the USS Saipan as the lead for the surgical team, we had a blast injury that came in, and unfortunately, it was extreme class 3 burns,
Mhm.
and it was just all over. And so, just having the know-how of managing a patient that is extremely burned, number one,
Yes.
having to secure an airway so that you have the opportunity to rehabilitate them was really tough. And I had an anesthesiologist, nurse anesthetist, and of course they were taking the lead on that. And unfortunately, they were not able to secure an airway. However, in hindsight, if I could have established a surgical airway, then things would have possibly turned out differently. But this, I think this was probably one of my worst experiences. And if I could go back, that is something that I would do, is to be quick to establish that surgical airway if needed to sustain life.
Uh, Absolutely. And yeah, especially I mean, for any of us who do infections, at a hospital setting, or we that skill set is invaluable,
Yeah.
to say the least. So to the trainees here, next time you're in a cadaver lab and your attending says we should do airway, it's not just because they want to. It's not just because they want to see you do another one. It's you
Yes.
never know
You never know.
um, when you're going to have to need it.
And in cases of extreme burns, with some of the technology that's out, it's good to know that of the possibilities of the tissue banks where you can,
Mm.
uh, help with the repair of those extreme burns. And that is something that I think is really an awesome innovation right now, because as you know, burns are really tough to restore.
Absolutely, especially in the neck region and everything that comes from that. There's
Yeah.
only so much you can resurface, and
Right.
when during my time at Walter Reed, unfortunately, but fortunately for my training, we did see a lot of that. But in the head and neck region, but of course the limbs also. Um, with your diverse experience, from your military training, can you kind of speak to how that impacts your current training, and how that has impacted your clinical decision making, now in your new role as a academic surgeon and faculty member?
Well, my primary and first thing is patient safety first, and looking out for the interests of others.
Yeah.
So I'm always looking to see what is the best treatment plan for this patient. I don't have a cookbook recipe for each person because each person is different, but I want to treat everyone with respect, dignity, and with the idea in mind of providing the absolute best care for them. And having been in the military for so long, I've had the opportunity just to interact with people from all over the world who were in the military and all backgrounds. And so I've had a tremendous amount of experience in dealing with patients, period. And I
Mhm.
know the importance of making that patient feel like you are concerned about them and their care and paying close attention to them so that they have that same feeling because it's going to help with the relationship and also with the patient care. So having learned that in the military and having dealt with many sorts of discrimination myself, I take all that as a packet and use that to make sure that I am exercising those principles in the way that I treat not just my patients, but my coworkers, my
Mhm.
assistants, my front desk staff, everyone. I want to make sure that they know that we are in this together. We are a team, and together we have to produce uh, the most outstanding quality care that we
Mhm.
possibly can, based on the circumstances.
Uh,
And that's it. So it's just how to treat people, and that translates
Absolutely.
to patient care.
Absolutely, and I can't agree with you enough. I think one of the unique things is get a little bit further in my military career. The team emphasis is a defining characteristic of military medicine and military healthcare. I mean, you can't
Yes.
operate and there's really um, you're part of something bigger than yourself, right?
Yeah.
In the end of the day, and I think one thing that humbles me every day is I think we have one of the most deserving patient populations there could
Yes.
ever be,
Yes.
and I think it allows us with that duty and responsibility to really take great pride in that patient care and getting them back to duty with a
Yeah.
very shared vision. So I agree with you, and it's one of the things that motivates me to this day, um, both at Balboa. And then I do a lot of work in the civilian sector too, and keeps me honest on both sides.
Yes.
Um,
Well,
uh,
I have to chime in on that because you're right. Our military personnel are quite deserving. They are doing an honorable thing to serve our country. And it was an honor for me to be able to serve them. And my time went by quickly because I thoroughly enjoyed working on those sailors and Marines, which is primarily what I worked on. Just an awesome experience so far.
Absolutely. Um, eh, Kind of changing the topic a tiny bit, but still the same vein. Just talking about practicing, medicine and surgery and dentistry overseas,
Mhm.
and the differences, the similarities, um, lessons learned. I just love to kind of hear your thoughts from all your experience providing this type of care, not in the four walls of a nice, air conditioned building here in the United States.
Well, I have to tell you, one of the things about the Navy is that they have really good spaces.
It's true. It's very
So
true.
my place, I spent 4 years in Yokosuka, Japan, and so I was able to run the surgery department there at the Naval Hospital in Yokosuka, Japan, as the solo oral surgeon for taking care of all the trauma and everything else that came in there. And occasionally you got some help if one of the carriers came in. You got a second surgeon there for a while. So that was good. So actually, it wasn't a true hardship because of the quality of equipment that we did have, in the Navy facilities. And so Yakutia, Japan, just the only biggest drawback is you're the only surgeon. And so I personally limited the the how grand of surgeries I would do. The double jaws were challenging. However, I screwed up with my orthodontist,
Yeah.
so they could tell me where they wanted everything, and so
Yeah, absolutely.
that made it easy. But just being limited to not having the additional surgical expertise of having a second surgeon, and just having to rely on yourself. Working with ENT colleagues was always good too, but there was usually only one, so it was kind of tough to coordinate large cases with them. Um, but we did cover for one another.
That's
Yes.
it. That's fantastic. And two of my co-faculty here in San Diego actually both were at Yokosuka. Um,
Yes.
and as a fun fact for those listening, the commanding officer of Naval Hospital Yokosuka, who just finished being commanding officer, was an oral maxillofacial surgeon, uh,
Awesome.
Captain Blair Hines, and
Oh,
now
very
he's in
nice.
charge of maritime headquarters for the Navy. So kind of exciting to see a colleague
Yes.
um, in that position. So making
That's
everyone proud.
That's impressive. The other thing about overseas is, of course, is when you're on a carrier, and then of course the carriers are very well equipped also for doing just about all that you need to do. And so once again, it wasn't a limitation of supplies and equipment.
Yeah.
It's just a matter of deciding to what degree you should be doing some of the surgeries. So that was it.
Absolutely. And I know even with the technology and advances today, that's still a consideration
Right.
for these overseas locations. And we
Yes.
get a lot of those patients here in San Diego, not because we have more surgical expertise or anything like that. It's just having the capabilities. And let's be honest, patients do better after major surgery when they're around their family and
Correct.
their support structure.
Correct.
Nobody likes having major surgery when you're on the other side of the world from your entire support structure. And I think that's one of the challenges of being a military surgeon is
Yes.
you have to consider things like that.
Right.
It's not just the diagnosis and treatment, but the social context around your patient, both personally and professionally, can be very dynamic. And your ability to do surgery, how it impacts their career progression
Yes.
and
Absolutely.
missing out on vital opportunities for them to promote and lots to consider than just the diagnosis when you're doing surgery in the military.
That's absolutely correct. Absolutely right. Which is why it's so important for you as a surgeon to be in touch and in tune with what your patients are going through, because sometimes little extra things that you can do for them can stand in the gap,
Right.
um, to, to, to take the place of what they're missing from not being home. Yes.
Absolutely. To get a little bit more in the weeds, can you reflect on a specific patient or an injury that may have changed your perspective about the potential use of tissue engineering or regeneration in maxillofacial surgery?
Well, the biggest one that comes to mind is the patient that I spoke about from the Saipan, the burn patient, and just being able to provide the absolute best care for them. The trauma cases, the facial fractures, etc., just the ability to have access to all of the nice technology now, the plating systems, etc., and the reconstruction, 3D reconstruction. Um, that's all fine and good. I'm looking forward to when we're able to match a part that is missing or
Hmm.
diseased that we remove to being able to make it,
Hmm.
tissue regeneration and replace those parts. I think that's in our future. And so I look forward to that. But as far as the specific patient, the one that stands out to me is the burn patient, and the traumas and things we can always deal with, facial fractures, reconstruction, but soft tissue reconstruction
Yes.
is a real big thing.
Absolutely. I had the honor of being very involved with the first trauma clinical trials while I was a resident, actually with our plastic surgeons at Walter Reed for spray skin technology. So pretty much epidermal mist is sometimes what it's called,
Mm.
because we had these massive burns, including the head and neck region, and um, we've already harvested all over the rest of their remaining body. There was
Wow.
nowhere to take another skin graft from. And
Yes.
so it's how could we volumize the regenerative soft tissue strategies? And so spray skin was one of the things that we brought. And it took a it took a literally an act of the president to get the conditional release, but luckily it worked out, and the patient continues to do well. And I love your point about, specifics, right? Like if somebody has a defect in the maxillofacial skeleton, actually getting something um, that is vascularized, but not from them.
Yes.
um,
Yes.
and although I love microsurgery and as part of my practice, I agree it'd be great if we could get that. I know there's a lot of people probably listening who have labs who are trying to solve that. And my big question to them, or my challenge to them, is it's one thing in an area where you have this nice wound, from a ablative resection, but how about a contracted, burned, right, soft tissue defect, and how are we going to make it successful for those individuals? So and I'm grateful for all the work that they're doing to try to figure that out for us.
The challenge, yes. I'm thankful for all the researchers who spend their time focusing on these things. It is so important. And this organization, I'm just really impressed with it and the fact that they provide funding, et cetera, and the direction for ongoing research. It's really awesome.
Absolutely. Now, kind of going a little bit more broad scope, as we still have a couple more minutes to catch up and talk, but more 50,000 foot view is just, broadly speaking, what's the main advantage do you see, or advantages, um, of being a surgeon in the armed forces?
Well, it is amazing. One of the things when I first came in the military was being in a large clinic where you can speak with
Mm,
officers from all of the different schools and take advantage of how they learn and their
absolutely.
that's just a massive plus benefit. You can just go down the hall and ask a question
Yeah.
to
Yeah.
someone, how do you approach this? How do you do this? And it's great. And then you have all the different specialties too, you know.
Yes.
And so that was one of the best things that I recall, from the group's military setting with the large clinics. Really awesome. And then also, just with the network, you can call and speak to another surgeon, just interact and get input from them if you have questions. Uh, and in some cases, you can take your patient over to the hospital if you need to,
Yeah.
and it's easy to do. And so it doesn't take a whole bunch. It's just phone calls and networking and getting the job done. That was just totally invaluable in the military. And
No,
that's at every duty station. That's at every duty station where you have multiple
absolutely.
people. So you always have those people there to help you and propel you. Yes.
Uh,
So from a professional
Absolutely.
point of view, that is just huge, really huge.
And for example, I just was at our academic session with our residents, and we have six faculty here, and all six of us train somewhere differently.
Yes.
And the discourse, and because we know with surgery there's 800 different ways to do the same correct surgery, right? And
Right.
nobody's right, nobody's wrong. And um I feel so lucky to have that protected time for that discourse,
Yes.
with the diversity of thought. And we have two maxillofacial prosthodontists down the hall,
Oh,
and
nice. Very.
orthodontist. And I mean, you're absolutely right. Not only that team that we already talked about, but the diversity of thoughts and opinions and backgrounds, I still think that the military is one of the most diverse workplaces in the world.
Yes.
Um, and it's for in all types of diversity. So I think I really appreciate your answer on that because it's what's keeping me in somehow 14 years later.
Yeah, that's well, good. I'm glad you're there. Great position. Teach those residents. Yes.
Uh, Absolutely. And so from your 33 years, of service, kind of looking back, right? What accomplishments are you most proud of?
That is an easy question for me. I
Oh,
am proud of the fact that I have so many residents that I trained,
mm,
as AEGD students or as general practice residents, or just rotators that came through and who got excited about oral surgery and went on to complete it. The director at Walter Reed now, I believe, is Jesus.
hmm.
Yes, he was one of my he was one of my um, um, rotators that came through when I was in at Camp Pendleton.
That's
And so to
awesome.
see him going from that to being a program, that is pretty amazing. And there's several others too, but he's one that stands out in my mind. But several others who have either, and especially some of my assistants, some of my dental assistants, who
Yes.
decided to get out and go to dental school and they come back in, and now they're commanders. That is just really awesome to see, and just several of those examples, and some of them didn't all go into the dental field. Some went into nursing,
Right.
and radiology, just all kinds of different fields, but seeing the progress of those people who I mentored back in the day. And you know what that points out to me? That points out to me that I'm now one of the senior guys.
You
I'm
are,
truly one of
sir.
the senior
You are.
guys. Yes, and it's
You have
really
the
awesome.
wisdom.
It's really awesome to see the young people coming up and stepping up. And
Mhm.
it's just so good every time I see someone who started with me, 20, 30 years ago, and see where they are now. It's incredible.
Absolutely, and yeah, it's not age; it's the wisdom that you now have for all of us. And I I I think you bring up something unique to the military that I just want to kind of underscore for the listeners that are watching and are listening to this is the relationship between us and our enlisted team. And
Yes.
it is unlike anything I've ever experienced. I work at a lot of civilian hospitals right now. I work with surgical techs, dental assistants, dental techs, in the civilian side too. But the mentorship, the right interdependence between a military surgeon and their enlisted surge tech or dental tech or lab tech is
Yes.
amazing. And I'm just starting to get to the point in my career where some of my dental techs or surge techs are graduating from nursing school or
Yes.
graduating
Okay.
from med school or dental school. I'm just starting to see that. And it's been really fun to see them from literally that 18-year-old kid who
Yes.
shows up in your clinic to now, being a colleague and doctor and even those who don't, those who go into senior enlisted ranks and watching them take care of the junior enlisted.
Correct.
Um, it's really, really special. And it's a small Navy. I feel like I continually come across them, every duty station. So thanks for bringing that up, sir, because I think that is unique is the relationship in the military between our enlisted colleagues and the officers.
Yes. Absolutely. Watching them progress is just a feeling of gratification, seeing their progress. Really good. Speaking of that, I just had one of my old um, surgical assistants get accepted to PA school. So
Awesome.
they're going there. So that's another field. So just really, really awesome to see.
Absolutely, absolutely. Going a little bit of outside the military, as we kind of get toward the end, is outside of surgery. We've been talking a lot about surgery, a lot about military. But what are you interested outside there? What kind of fills your bucket outside those things?
Well, I fill a lot of my time with surgery because I really enjoy
Me
teaching.
too.
And so outside of that, I work at my local church in the bereavement ministry. That is a tough
Oh,
ministry. So
yes,
I assist the lead director of the bereavement ministry and do presentations usually twice a month. And so that is just a really fulfilling um, extracurricular thing that I do, and also helping them to step through all the stages of things that they have to do when they lose a loved one. And so that's
absolutely.
it. Also, I was involved for many years with a group called Garden Path Ministry, which was a food ministry for those in need. And we've kind of turned that over to helping hands. And so I participate with the local Helping Hands ministry for food distribution, which reminds me, tomorrow morning at 7 is food distribution. So here we go. Uh, so so that is it. Outside of that, I really like staying fit. I work with a group called F3, which is for Fitness Fellowship of Faith. Great group all over the country, and I work out with them 3 to 4 times a week, and we meet at 5:30 in the morning. And so by 6:15, I have my workout in, and I'm ready to start the rest of my day. So being involved in that. Outside of that, uh, at home, I used to play the bass when I was in high school and college.
Okay.
And so I have a bass and I've committed to going back and playing it. However, I've gotten interested in guitar and piano. So I take turns. I spend time practicing the guitar, time practicing the piano. My goal is just to be able to sit down and play just calm songs that I enjoy, worship songs and things like that. So that occupies most of my time.
Well, that sounds like a really full, but I don't know, just hearing you speak about it, the word joyful comes up.
Yes,
Just,
yes.
so it sounds just like a full joyful, outside of surgery. And it kind of, goes into my last question, kind of talking about your typical day. And are there specific routines or things you do that have made you successful? I think you touched on some of them with that faith based and that fitness and some of these other things. But yeah, what what kind of routines do you have that you think have given you such longevity in your career and success?
Well, I've been blessed to be able to um, have. I grew up in a faith-based home, and so that has sustained me all the way through. I know that a lot of my successes have absolutely nothing to do with my personal abilities. It has been through the divine direction of God. And I know that for a fact because of the people who just kind of drop into my life for a season to set me in a certain direction and push me on. And
Mhm.
so just having a strong faith based background and stand in the word. Now, I know a lot of people study the word for the intellectual portion. I study it so I can do it. So I want to practice the things that I profess to believe. And that is the real challenge because we all make mistakes and fall down, but we have to get up and get back on track. And that's one of the keys. When you do make mistakes, you get up and keep going. That's life. And
Mm,
in addition to that is making sure that I spend quality family time. I have
yes.
a wonderful wife who's been supportive of me throughout my career. And so spending quality time with her is important as well. Studying, I have plenty of time for that in my travels back and forth. I listen to lots of studies, which is good. And I also have a chance to listen to the word or listen to a book. And so that's really great. So that when I get home, I can spend some quality time. Also, I am an avid Scrabble player. Love
Oh.
Scrabble, and so I take on all comers and have a
Challenge
good time with
accepted out there.
them. There you go. So that's in a nutshell. I try to make sure I work out 3 to 4 times a week in the morning, 5:30 in the morning, and then carry on with my day from there based on what's scheduled, taking care of work things and study things. That's
Well, I appreciate that as somebody who's kind of now I'm about 5 years out from fellowship and trying to bring back those hobbies and the
yes.
routines and habits that I may have let go over the past decade or so. So, thanks for inspiring me to do better and think bigger on that topic. And I just want to say thank you. This has been so much fun. I think one thing about the military is, you know, we don't know each other very well before, this conversation. I feel like now I can, say a lot about you, and I feel like I know you extremely well just because our mutual backgrounds and ties and
Yes.
stuff like that. And I think that's just one of those intangible, invaluable uh, things that the military brings. So thank you for being willing to be on the podcast. Thank you so much, to the Osteoscience Foundation for recognizing what the military brings to oral maxillofacial surgery and regenerative medicine. We know a lot of the techniques that are currently being practiced were developed in the U.S. military and with our, partners around the world. So just want to thank the Osteoscience Foundation for that too. Sir, any parting wisdom or thoughts?
No, I just want to thank you for taking the time to interview me and to share your expertise as well with the military. It has truly been an honor to be able to speak on behalf of military surgery and my experiences. Really excellent. But also, I want to say that I am really enjoying being on staff at Loma Linda Oral Surgery Department. Dr. Herford is an amazing um, man to work with, and of
Mhm.
course, he's very well world renowned. And also Dr. Viet. It's a real honor to be able to work with them and learn from them and participate.
Absolutely, and I work with both of them in different routes, and I can attest to Loma Linda and just the incredible program that you all have there. So, thank you again for your time, sir, and I really look forward to our paths crossing.
Very good. Thank you so much. Okay,
Thank you.
bye-bye.
To learn more about Osteoscience Foundation, visit osteoscience.org or follow us on Instagram, Facebook, and LinkedIn.